Monitoring effects of enoxaparin is vital throughout treatment. CBC should be drawn periodically, paying special attention to platelet counts. Additionally, stool occult blood tests should be run to check for microscopic amounts of blood in the patient's stools. When assessing patients on enoxaparin, you should be cautious of excess bleeding, signs of hematoma, and symptoms of neurological impairment. As always, patient teaching is important with any type of drug therapy. Regarding enoxaparin, the patient should be warned that the drug may cause edema, diarrhea, nausea, hematoma, confusion, dyspnea, or fever. Instruct the patient to report signs and symptoms of bleeding, pulmonary edema, skin necrosis, or AFib. If the patient is self-administering, advise them to rotate injection sites. Patients should avoid concurrent use of NSAIDs and aspirin without healthcare professional approval.
One hour later. 2 hours later. 3 hours later.
So much later that the old narrator got tired of waiting and they had to hire a new one.
Oh, you are
Oh my god! It's so high! My blood pressure is never that high! What is wrong with me?
So we might need to consider some antihypertensives along with those anticoagulants.
Okay.
Just gonna let the doctor know about that in a few minutes.
Okay.
Why should it be that high?
Because people in the hospital are really stressed out. And then she had a total knee, so.
Could it be my pain, maybe?
You know, it could be. So we're just gonna go ahead and record that. And then we're just gonna let the doctor know about that in a few minutes. So I'm gonna end up giving you enoxaparin today. And the reason you're getting that's an anticoagulant.
What is that for?
Well, it's because she's just had a knee surgery and a lot of times the blood will clot and we don't want that. And it's going to end up causing a lot of clotting in the veins and preventing blood flow.
Okay.
So what this is for is just going to thin that out. So it's going to be a lot easier flow, but it's not going to clot as easy. So if you do end up getting cut, it's just going to flow.
Okay, is it a pill I take by mouth every day or what?
Unfortunately not. It is a shot and we have to give you every day. And it's not only because of this, it is something we just generally recommend for every patient that's in the hospital.
Okay.
So you're not singled out for it or anything.
Does she get it in her arm or her leg, or where does she get it?
Well, we give it in the abdomen. We're
Okay.
going to have to give it 2 inches away from your belly button here. And we're going to rotate sites every day, so it's not going to be in one spot. So you are going to get pretty bruised up on each side.
Okay, I hate shots. I pass out every time I get a shot, so.
Okay, well, we're going to end up, well, because of that, we'll just keep you, I'm going to monitor you for about 15, 30 minutes after your shot.
Okay.
Okay?
Alright, that'll make my blood pressure go even higher.
Well, I can't, well, then that's a good thing. I'll talk to your doctor and get some hypertensive medication for that then. But is there any questions?
Is there any like side effects for it, or?
Well, you know, we do have some anemia, some diarrhea, nausea, things like that. Worst case scenario would be that you would be paralyzed.
No. I'm not taking that drug.
But it's so rare. We just have to let you know because it is a black box warning, and it's just something we have to make everybody aware of.
So, like, the chances of me getting paralyzed are like what, 1 in 1,000?
I'd say about 1 in a million. It's
Okay.
just kind of,
Alright,
it's just
okay.
rarely ever going to happen,
Okay.
but it's a possibility that it could.
All right, lovely.
But yeah, you have a higher risk of getting in a car accident than you do of getting this.
Okay.
It's just a chance. Okay. So, any other questions?
No, I think we're good. Do you think you can bring us like an information sheet with like cost and stuff? Cause
Yeah, she's gonna obviously have to be taking it a while, so it might get kind of expensive, right?
Yeah, it can be. And you might not actually go home on this exact medication. There is heparin and warfarin that you could go home on too. Heparin is also an injectable medication, and warfarin is a pill that you'll take by mouth. But it's all just going to depend on what your doctor exactly wants you to take. So I will get you an information sheet on the pros and cons of each one, cost benefits, warnings, signs, symptoms, stuff like that.
Okay, great. Thank you. That'll help.
Thank you. Can I get y'all anything before I go?
That's it. No, we're good.
Any pain in your knee or anything?
It's just a little sore, but
Okay.
other than that, it's pretty good.
Okay. Well, I will be back in a few minutes with your enoxaparin.
Okay, great. Thanks.
Thank you.
2 hours later.
Hi, Abby.
Hi.
Okay, I'm back with the enoxaparin, and I brought the pamphlet for you for information. So the cost is that if you buy it from a Walmart pharmacy, it's going to be about $28. If you buy it from a Sam's Club pharmacy, about, again, $28. Target, about $38. About $49 at Walgreens. And $73 at CVS, so I
That's
definitely
not going at CVS.
I don't recommend it.
But that's doable. We can do that.
Okie dokie. You go and lift up your gown for me. Okay, let's see, 2 inches. Okay. Now this shot is going to burn a little bit going in, so I'm going to have to give it slowly. Okay?
Great. What you humming to?
I don't know. The song's in my head.
I'm getting kind of hot already. I'm nervous.
Abby, it's okay. It's just, it'll be real fast.
Well, luckily you're already laying down. So.
Oh, okay.
Okay. Are you ready?
Mm-hmm.
1, 2, 3. Okay, all done.
See, that wasn't so. Oh, she's okay.
And this video is brought to you by Anticoagulants.
Thank you for joining us for contraindications.
Contraindications.
What are they?
What are they?
Thrombocytopenia,
Thrombocytopenia.
active bleeding,
Active bleeding.
hypersensitivity.
Hypersensitivity.
The end.